Up next on Profiles in Caring, presented by Equitable Life and Casualty. A spirited group of women in the Palm Springs area are spearheading a project to provide mammograms for free for any woman who needs one. Profiles in Caring is next. GoodTube, a website devoted to videos on good people, good works, and good news about the nonprofit world. Grab your video camera and share the inspirational stories of your charitable group. And each month, the best nonprofit videos uploaded to GoodTube will win a grant of $1,000 and be featured on the internationally syndicated TV program Profiles in Caring. It's free, it's easy, it's GoodTube.
The following Profiles in Caring is made possible through generous support from Equitable Life and Casualty, committed to caring.
Welcome to Profiles in Caring. I'm Kimberly Perkins. We're in the Palm Springs area right now, a luxurious part of the California desert known for its beautiful golf courses and equally lovely homes. But outside the gates of these luxe communities is a very poor population. Many of the groundskeepers of these fairways and gardeners of these flowers have no health insurance. And we found a group of California women who say that's just not right, and they're doing something about it. What is Desert Women for Equality, DWE?
Right now, Desert Women for Equality is a nonprofit California corporation, and our major focus, and only focus at this point, is to raise money to do free mammograms for the women of Coachella Valley, the uninsured and underinsured women of Coachella Valley.
Good afternoon, free mammogram program. That's July 15th, and we're just now starting to take appointments for that.
It was 2003. I had been in the desert for about 2 years and was not very active in any charitable organizations. I was building my law practice here, and Diane and Elaine called and said there was a group of women coming to their house to sit in the back patio, 20 to be exact, and they wanted to figure out what they could do to help our community. Many of them were retired. All of them were gay, lesbian women, and I joined them.
Some of the women wanted political, some wanted to do good.
We were going to help get more women in politics and just be a watchdog for gay and lesbian legislation to make sure that we could be there to help with equal rights.
Eventually what happened is that we had a facilitator fly in from Seattle to help us decide what we wanted to be when we grew up. And that's when we decided we wanted to do good, and the political faction went off on their own. And it was Barbara who came up with the idea to do the mammograms.
My personal reaction, because I worked 30 years in the medical field, was, okay, Barbara wanted to do a clinic, and I said, mobile mammography then. And she hadn't thought of that at all, but I said, I know the mobile mammography is possible to do. And that way we could go to the women, because what we have found is that the women we serve are the truly poor. They have been the forgotten women. They cannot go to the, quote, other free programs here because they don't have doctors. So if they don't have a doctor, they probably don't have a car either.
All they do is make a phone call. There's no financial means test. There's no qualifications other than being 40, and they self-refer. What we discovered that there were some other resources to get mammograms, but every woman needed to have a doctor in order to avail herself of those services. And we thought there was a forgotten woman in our valley, the women without doctors. And so we don't need doctors. We have doctors to refer them to should they get an abnormal result in the mammogram.
What we knew was there was a tremendous need. We knew that there was 21% of the women in California that didn't have health insurance, and there's an additional percentage, I believe, that have only catastrophic coverage.
We knew that there were several groups of people that were underserved in our community, and we also knew that lesbians, African American women, and Hispanic women were really dying unnecessarily from breast cancer.
How excited were you to learn about a free, I mean absolutely free, chance to get
That's the best. That's an absolute best. You know, mammograms have gotten more and more expensive, And if you're retired and you're on a basic income and you don't have too much money, you know, you put off things that you normally would have taken care of when you were working or when you were younger. So this is a wonderful opportunity.
If I were to just pay for this out of pocket, how much would a mammogram that you're providing cost?
Depending on your coverage.
Let's assume I have no coverage.
If you had,
I'm just paying out
if you
of
just
pocket.
go into a clinic, a hospital, or whatever, it'd run anywhere $300 to $500 and up, depending on the facility you went to. So when the women come to us and it's free, many of them give us donations, whatever they can afford. We've had one woman at the last clinic give us a $100 donation because she said it was so much cheaper than what she would have had to pay had she gone on her own, which would have been around $300 to $400.
And the women that we're getting in now, a large share of them are saying, you know, I didn't think this would ever be me. I've lost my job now, or my husband's lost his job, or we were not able to continue on with our insurance payments, or COBRA. If there has been a job loss, COBRA is just not affordable for a family. So women are now seeking other ways to try to have preventative care.
Do you mind me asking what happened? Did you lose a job? Did you
Well,
just money?
my 30-year marriage went down the tubes and the health insurance went with him.
It's tragic, that feeling, isn't it?
I'm not alone. There's lots of other people same thing happens to.
Have you used this free clinic before?
No, I read it in the paper and my doctor's been after me to do it because I have a history of breast cancer in my family. So when you have a history of breast cancer in your family, you have to keep up the mammograms.
And the women are women that have worked, and may still be working, but they're working in jobs where they're making $8, $9 an hour, and out of that amount of money, they cannot pay for health insurance. They're just doing well to pay for their rent and their bare necessities.
I was fortunate enough to see a notice on the bulletin board in my RV park.
And how lucky is it to find a place that does it absolutely free?
Well, this is very wonderful. Normally, I'd be paying, you know, $50 to $100 at least for a mammogram. So it's a very good thing for me.
Is it harder in a community like this where the wealth is so exuberant and the poor are so poor, for them to feel like the services are as available as in opposed to LA?
You'd be shocked if I said, come for a ride with me, how many poor communities there are. And how many, you know, it's a service town. And your service people, your waitresses, your hairdressers, and I can go on, your little tailor shops, your painters, people who paint the house, the gardeners, their wives. Sometimes I just go walking and hand it to the gardeners for their wives. And that's why we're so well received, because we're so needed. The wealth is conspicuous, but the poverty is terribly obvious when you go look for it. And keep these cards in the back of my car. And when I go into restaurants, I take some. You'd be shocked at how many Americans either don't have coverage or have catastrophic coverage that they have to pay. By the time they find out they have breast cancer, it's too late for real help because their coverage won't cover any preliminary preventative medical examinations.